Hello everyone, I am Dr. P. Tilagis, Assistant Professor, Department of Pharmacy Practice. Today we discuss about antibiotics used in the skin disease and also it is the essential guide for the treatment. What is meant by antibiotic means antibiotics is used to kill the bacteria infection or stop the growth of bacterial infection. This is the definition of antibiotics. First of all, antibiotics used in the skin disease essentially guide for treatment. A comprehensive overview of antimicrobial therapy for the bacterial skin infection from first-line topical agents to systemic treatment strategies. First of all, it is the antimicrobial therapy. Antimicrobial therapy means any microorganism, bacteria, virus, fungi. These are the antimicrobial therapy, and also it is mainly used for the bacterial skin infection. Bacterial skin infection from first-line topical agents to systemic treatment strategies. Topical agent means it's any ointment, creams. These are the topical agents. And also, it is a common bacterial skin infection like impetigo, cellulitis, and erysipelas, and folliculitis, and abscesses, and necrotizing fasciitis. What is meant by impetigo means superficial and highly contagious infection mainly affecting children's. It is mainly affecting children's caused by Staphylococcus aureus and Streptococcus pyogenes and present with the honey crusted lessons. And also cellulitis and erysipelas. It is a deeper tissue infection. It is the deeper tissue infection and characterized by erythema, edema, warmth and pain and erysipelas involving the superficial dermis with the clear demarcation. And also folliculitis and abscesses, hair follicle inflammation ranging from superficial pustules to deep furuncules and carpentals abscesses are pulled collections recurring drainage. And also necrotizing facilities, life-threatening infection. It is the life-threatening infection. Life-threatening means it is a death conditions. So it is the common vital skin infection. First one is impetigo, cellulitis, and erysipelas, and folliculitis and abscesses, and also necrotizing facilities. Next, what is maybe topical antibiotics? It is a first line for localized infection. It is a first line means if you have the any infection, you will go to the hospital. Doctor, any healthcare professional first choose the first line therapy. You choose the first line therapy. That is called first line for localized infection. If I like um, NSAID drugs, non-steroidal anti-inflammatory drugs. If you go to the any symptoms of hospital like headache and fever. NSAID have the used for the pain and inflammation, analgesic and antipyretic. Paracetamol cure the headache and fever. Ibuprofen cure the headache and fever. First choice of headache and fever, doctor choose the paracetamol. That is called first line therapy. It is a safety and efficacy. So why choose the first line therapy means it is a very safety and efficacy and a short time duration of the disease. And also first line for localized infection means mupirocin, highly effective against gram-positive bacteria including MRSA and limit use for 10 days to prevent the resistance development. Acetic acid, narrow spectrum agent for streptococcal infection and restrict to topical use only to minimize the resistance risk. Hydrogen peroxide is a 1% recommended by NICA for localized non-bullous impetigo safe and effective alternative to the traditional antibiotics. This is the topical antibiotics for the first line for localized infections. Next one, systemic therapy. Systemic antibiotics for widespread or severe infections. First, oral beta-lactams. Example of drug oral beta-lactam means cephaloxime and dicloxolin are the first line drug for the cellulitis and extensive impetigo and excellent coverage for the methicillin sensitive strains. MRSA active agents. It is the example of clindamycin, doxycycline, and trimethoprim, and sulfamethoxone provide the coverage with an MRSA suspected by the confirmed. Next, intravenous option. What are the intravenous means IV? Vancomycin or piperacillin with tazobactam. This is a combination of piperacillin with tazobactam or piperacillin with sulbactam for the severe and systemic infection for the hospitalization and infections. Next, managing secondary bacterial infection in eczema. It is the first is reserve antibiotics use if bacterial infection confirmed and topical corticosteroids, intensive topical therapy first, and also check systemic signs, look for the fever or malaise. Next, assess severity, evaluate and extent and symptoms. Then the diagnostic approach prevent the antibiotic overuse while ensuring the appropriate treatment. It is the cle- clinical principle. Not all eczema flares indicate bacterial infection. Many respond to intestinal topical corticosteroid therapy alone. Like prednisolone, these are corticosteroids, mineralocorticosteroids, glucocorticosteroids. These are antibiotics for the patient with a systemic illness, fever, malaise, and clear sinus impetigo. And choose between topical and oral antibiotics based on the extent of infection and the patient family preference. Avoid routine skin scabs. It is the main managing sign of bacterial infection in the eczema. So, what are the diagnostic approach means? Reserve antibiotics and topical corticosteroids and check systemic signs and also assess severity. Next one, antibiotic resistance, a growing challenge. It is the MRSA prevalence, methicillin resistance, Staphylococcus aureus resist beta-lactam antibiotics requiring alternative therapeutic agents. Misuse acceleration, incomplete treatment courses, inappropriate prescribing and excessive topical antibiotic use drive resistance. And also biofilm protection. Bacterial biofilm create physical barriers that complicate antimicrobial penetration and eradication efforts. Stewardship essentially limit duration and use shorter effective courses and avoid complication antibiotics and unnecessarily in the antibiotic resistant growing challenge of eradication efforts. What are the evidence based recommendation and NICE and IDSA? NICE guidelines means hydrogen peroxide 1% of topical antibiotics were localized impetigo and oral antibiotics fluoxetine and clarithromycin for systemic for the bullous forms. Next one, combination topical and oral therapy not recommended. This is the not recommended combination of topical and oral therapy. And also review after 7 days if no improvement. Next one, IEDSA recommendation. It is tailored therapy based upon the infection and the type, severity and patient factors and MRC coverage when epidemiology indicated or culture confirmed. Duration 5 to 10 days for the most uncomplicated infections. And also referral for immunocompromised or complex cases. Case example, treating impetigo in the children, initial assessment and localized treatment and widespread infection and family education and follow-up. What is maybe initial assessment means determine the if lesions are localized non-bullous or widespread bullous, check for the systemic symptoms, localized treatment, hydrogen peroxide 1% of cream and TDS or 5 days, or mupirocin 2% of TDS for the limited areas. TDS means thrice in a day. Okay. Next, widespread infection, oral fluorescein 20 to 5 to 50 mg per kg per day. It by QDS or cephalaxin for 5 to 7 days. And the family education hygiene measures and avoid standing towels, keep nail shorts and exclude for school until lessons trusted. Follow up. Research if no improvement after 7 days, consider bacterial culture and sensitivity testing. If the treatment is not improved in the 7 days, you will go to do the culture and sensitivity test in the bacterial. Consider the bacterial cultural and sensitivity test in the laboratory methods. Next one, emerging alternatives and support care. Beyond traditional antibiotics, as resistant challenges mount, innovative approaches often promising adjust to the conventional therapy. And also bacteriophage therapy. Viruses targeting specific bacteria so promise for the resistant infections. And also antimicrobial peptides. It's the natural defense molecules with broad spectrum activity under the investigation. Wound management, gentle cleansing with saline or antiseptic aids healing. What is my saline means on NSRL DNS. Emollient therapy essential for the eczema patient for the restore the barrier infection. What are the safety first? In the monitor all patients for adverse effect including allergy reaction and gastrointestinal symptoms and organ toxicity, especially in the pediatric and elderly population. Pediatric means in the child range, elderly means older age 60. What are the conclusion and optimized antibiotic use in the skin disease? Accurate diagnosis and targeted therapy and resistance vigilance and collaborative care. Through clinical assessment and severe grading guide appropriate antibiotic selection and route of administration and target therapy. Priorities and topical agent for localized infection, reserve systemic antibiotics for the extension severe presentation, resistance, vigilance, practice antimicrobial stewardship through the appropriate duration and avoid unnecessary combination patient education, collaborate here, engage and dermatologists and infectious disease specialists by complex and recurrent and treatment and resistant infections. These are all the overview of skin disease. Okay, mainly skin disease. What are the drug used in the skin disease? Means antibiotics. Antibiotics is used for the antimicrobial infection. Like example, impetigo, eczema. These are all the skin disease. What is the approach of skin disease? Means first of all, diagnosis, accurate diagnosis, and the targeted therapy and resistance vigilance. The collaborative care. These are all the overview of skin.